Shingles, Symptoms and Treatment Options by Mary Copeland. Shingles, also known as herpes zoster, is a viral infection caused by the varicella zoster virus, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus can remain dormant in the nerve tissues near the spinal cord and become reactivated later in life, causing shingles. How common is shingles? About 1 million cases of shingles are diagnosed every year in the United States. The risk of shingles increases as you get older, with about half the cases occurring in people over the age of 50. Shingles develops in about 10% of people who have had chickenpox at an earlier time in their lives. Anyone who has had chickenpox can develop shingles. Most people get chickenpox during childhood, but the virus remains dormant in the body and can reactivate decades later, especially when the immune system weakens due to factors like aging, stress, or illness. The bad news is that if you're an adult who hasn't had chickenpox, you're at a higher risk of suffering severe complications if you do get it. Chickenpox is much more dangerous in adults than it is in children, which is why it's recommended that adults get the chickenpox vaccine if they've never had chickenpox. If you have not had chickenpox before, you cannot get shingles directly because shingles is caused by the reactivation of the varicella zoster virus, which lies dormant in individuals who have previously had chickenpox. However, if you haven't had chickenpox and come into contact with someone with shingles, you can potentially get chickenpox from them, not shingles. Adults that don't know if they have had chickenpox as a child can have this determined by a laboratory test. Chickenpox is much less common now than it was before a vaccine became available, so parents, doctors, and nurses are less familiar with it. The reactivation of the varicella zoster virus may occur as a result of lowered immunity. This may be due to infections, age, or having a weakened immune system due to medical treatments or disease. And while stress may not directly cause or trigger shingles, there is a link between the two. Large amounts of stress can wear away at the body's immune system, lowering its ability to defend against all sorts of viruses, shingles included. Shingles symptoms typically manifest as a painful rash that appears on one side of the body or face. It often starts as a tingling or burning sensation in a specific area, followed by the development of a red rash and fluid-filled blisters. Often symptoms can include fever, headache, and sensitivity to light. Treatment for shingles include antiviral medications such as Aceclidine, Valaclidine, or Famaciclovir, which are commonly prescribed to reduce the severity and duration of shingles if started early, within 72 hours of rash onset. Pain relievers, topical treatments, and anti-inflammatory medications may also be recommended to manage pain and discomfort. While shingles is usually not life-threatening, it can cause severe pain and discomfort. In some cases, complications such as post-therapeutic neuralgia, which is persistent pain in the affected area even after the rash clears, vision loss, if the rash occurs near the eye, neurological problems, and skin infections can occur, especially in older adults or individuals with weakened immune systems. The best way to prevent shingles is through a vaccination. Shingrix is the preferred vaccine recommended by the Centers for Disease Control and Prevention, CDC, and World Health Organization, WHO. Shingrix is a non-live vaccine made from a recombinant protein and is highly effective in preventing shingles and reducing the risk of complications. It's given in 2 doses, usually 2 to 6 months apart. The CDC recommends Shingrix for adults aged 50 years and older, including those who have previously had shingles. Adults who are unsure if they had chickenpox or adults who received the Zostavax vaccine. Zostavax vaccine was the first shingles vaccine available, which contained a weakened live virus. It is no longer recommended or available in many countries due to concerns about its effectiveness and potential side effects. The effects of the Shingrix vaccine last for at least 4 years in most people and may last even longer in some. According to the CDC, you do not need a booster dose after getting the 2 doses of Shingrix. Shingrix is widely available in pharmacies and healthcare settings where vaccinations are offered. It is advisable to check with your healthcare provider or local pharmacy to inquire about availability and any costs associated with receiving the vaccine. The cost of the shingles vaccine can vary depending on your location and healthcare provider. In many countries, including the United States, the vaccine is covered by health insurance, Medicare, and Medicaid for eligible individuals. Some pharmacies and healthcare providers may also offer the vaccine at no cost under certain public health programs or during specific vaccination campaigns. Getting vaccinated against shingles is highly recommended, especially for adults age 50 and older, to reduce the risk of developing this painful and potentially debilitating condition. While there is no cure, prompt treatment with antiviral medications can help reduce the severity and duration of symptoms. It's important for individuals who suspect they have shingles to seek medical attention promptly to minimize complications and discomfort.